Hello everybody, Santino here, and I am recording from work, a clinic where I work as a medical assistant in urgent care setting for the University of Washington. Here we've been doing the COVID-19 swabbing for almost 2 weeks now, and it's been a great success, and we've been able to help many people. Now, I'm just getting on here quick to kind of share some feedback. What we've heard has been helping the patients that we've been coming into contact with, and what the providers I work with in this setting have been telling our patients to do as far as intercepting this transmission or being safe. Now, we understand that this is a respiratory illness. The symptoms are fever, cough, shortness of breath. And a lot of places are isolating patients when they come in with one or any of these symptoms combined. And what we're telling patients to do is one, social distancing, 6 feet from everybody else. If you can just maintain your 6 feet from everybody, it's a great practice to have. If you are somebody who is symptomatic, who has been tested or hasn't been tested yet, the best thing to do is to self-quarantine at home until you do get the care that you need. Now, if you're someone that doesn't have insurance or someone that doesn't have the money to go to clinic, remember the federal government is promising that everybody can get out and get tested and get care. So look into your resources for this, okay? The other helpful hint is to remember hand sanitizing, washing hands at least 20 seconds, hand sanitizing with Purell. These are some of the best practices that have been working out there. And also another best practice to have and to remember is consideration for the people around you, for your community. In a previous video, I spoke about personal accountability to yourself. And we as people were able to take personal accountability, we're able to better protect our families and better able to protect the community. Again, there's still this scare going on around there about, food demand, toilet paper, hand sanitizing. And again, I just ask people out there to, again, be accountable, sit down, learn. If you're going to put yourself in a position where you're having to hoard everything out there and taking necessities away from other people that have families, I think you owe it to yourself and that community to sit down and learn about this virus and what it does, its transmission, what it's like, and how you can help to keep it from happening, okay? Again, the symptoms are shortness of breath, cough, and fever. If you have any of these, please self-quarantine. Do not walk straight into an urgent care. Do not walk straight into an emergency room. Give your doctor's office a call and explain your symptoms and have them better give you instructions on what to do next. And this way, what you're doing is that you're preventing possible transmission or exposure to anybody else in the community, okay? Now remember, we have to remember that it's just not the community or anybody out in the community exposing us. We can potentially be someone that's already exposing other people. So again, personal accountability, and just try and be a good steward to your community, okay? Again, a few pointers to get through these tough times. One, social distancing, about 6 feet from each other. Two, hand sanitizing techniques, washing your hands very good for about 20 seconds, or using like Purell or an alcohol-based sanitizer. Try not to use any antibacterial products, because when you overuse an antibacterial product or you abuse an antibacterial product, you do end up killing the good bacteria or good flora that your skin has. Yeah, your skin does carry good bacteria on it because it has to have a way to help defend itself against, outside elements. So if you're abusing antibacterial products, you're getting rid of that good bacteria, leaving possibility for exposure, to anything out there, MRSA, anything like that, okay? So again, obviously crazy tough times. We see exposure rates increasing, death toll rates increasing, but remember, the best thing we can do is personal accountability and being good stewards to ourselves, for our families, and for the community, because we all really need to be able to help each other and try to understand each other. And I know many of you will probably see this and say, well, whatever, I got to take care of myself and my family first. Fine. go ahead. But for those of you who do have a conscience and a consideration for other people out there, just remember, this is not something that you need to stop living your life for. Obviously, you're going to want to follow any laws or mandates that might be being passed in your area. But again, please remember, everything I've spoken about when it comes to some of these helpful tips or things that we've heard from the community that are working for them, and what I've heard the providers giving advice, and even myself when I come in contact with a patient. Okay, so I hope this was useful, and again, guys, best of luck, and please take care of each other. Okay, all right, until next time.